The World Health Organization has urged nations to make every effort to deal with the COVID-19 pandemic, which shows no sign of slowing down at the moment. Now, Italy, the most affected country in Europe, is now an example of how rapidly the virus can spread. The country has more than 31,500 confirmed cases of COVID-19, and so far, more than 2,500 people have died, while close to 3,000 others have recovered. This according to John Hopkins University. Now, to give an indication of just how fast the virus spread in Italy, Al Jazeera news agency gave an illustration this weekend, saying that the number of positive cases in the country rose from over 24,000 to around 28,000, with 368 deaths just between Saturday and Sunday alone. Now, South Africa is still fortunate to have a small number of recorded cases at this stage, but an aggressive approach is needed to keep those numbers down. The Social Development Ministry issued a statement yesterday on measures that will be implemented to limit the spread of the virus. And joining us now from our Seapoint studios is Social Development Minister Lindiwe Zulu, who is also a member of the COVID-19 Ministerial Task Team. Minister, good morning and thanks for speaking to us here on Morning Live.
Good morning, Sakina, and good morning to the morning viewers, those who are up and about already.
Minister, your portfolio, of course, needs to take care of the most vulnerable in society. And maybe just getting your opening remarks with regard to COVID-19 and some of the work that the Interministerial Task Team has undertaken.
Yes, well, I've been fortunate that I've been sitting in the interministerial from the very time that the news broke about COVID-19 coronavirus, and therefore I've had the advantage and opportunity of listening to various departments, including the Net Joint, which has been the one that's been a little bit on the forefront, because you recall that we had those students who were out in China, and they returned back home very well, and everything went like military precision, quite frankly. But of course, we must recall that we still have students who were left behind because the temperatures were a little bit high, and then therefore steps in the Department of Social Development to make sure that we get in touch with their families, because this is very stressful for their families. So we've been in touch with the families, keeping them informed about what's happening with their children. But also we've got the embassy in China that has been in touch with them back home. I don't think there's anything as painful as seeing the flight leaving you behind, but I think that they are being taken care of. Coming back home and being a member of the interministerial gave me an opportunity also to start thinking very fast about what our department has to do. I set up a task team within the department which brings together my department, SASSA, and the National Development Agency. And immediately after that, once the President made the declaration, I was able to connect to all the MECs through teleconferencing, all the MECs of the provinces. And I was really pleasantly surprised that most of the provinces had stepped up on their own, were beginning to think about what plans they need to put in place. Here's what is important. All the provinces need to make sure that they follow on action plans, because I can sit at national and be able to declare this and say that the people who are on the front line are our staff, for instance, in SASSA offices, in social development offices. So the first important thing for me is to make sure that our own, through our social wellness, our wellness centers, our own must be protected. Therefore, need to expose themselves to all the necessary information, read everything that government is saying, is churning out as in terms of information, because they won't be able to help anybody else if they don't start by helping themselves. And our task, together with the CEOs of SASSA and NDA, is to make sure that we provide the necessary support that they need to get. And we are thankful that obviously the President has made the announcement, which enables us to trigger our own internal processes of protection for our own first.
Now, to that point, Minister, speaking of the social development staff who will be on the front lines, incidentally, someone claiming to be from the Kwamhlanga SASSA branch called into a radio station and said they will not be rendering any service. They're not going to work until they are issued with protective gear. So what sort of initiatives have you put in place to deal with that? And are you aware of such concerns from your own staff?
I'm very much aware of those concerns. The CEO of SASSA did speak to us in the meeting that we had to say that there were staff concerns. That's why I said the first important thing is for us to make sure that we provide the necessary support to the staff, including that we must make sure that there's water in the offices, we must make sure that there's sanitizers, we must just make sure that the guidelines that are given to us for protection are adhered to, because they won't be able to help anybody if they are not protected themselves. So the directive clearly came out to say the regional managers, which we call the RAMs, must make sure that they connect to the national office, but they must also work with the MECs at the provinces, because what we need to do here is to pull our resources together, both financial and human. I would never dismiss those concerns that are being raised by the staff, because they are also parents, they are also human beings, and they are in the front line, so they need to be protected in order for them to be able to protect others. Secondly, SASSA itself in particular, because they have to go, the recipients have to go to the post offices. We have to make sure that even working together with the post office, we must make sure that everything is in order that side. The one advantage that we have is that the majority of our recipients are getting their money through the banks. They have bank accounts, and so they go to the ATMs. Some of them go to the retail to go and buy whatever they want as food and so forth. So the call we are making, and we're working with the post office obviously, but the call we're also making is that where our clients go to for services, we must make sure that they are protected. We must step up. Information, and I think the president has been very clear about that, requesting that we send out as much information as possible, especially to rural areas and in the township. We have to flood this information, billboards, posters, anything that we have, but we have to use the media, and especially your radio stations, because most of our clients are elderly who are very vulnerable, and therefore we have to flood as much information as possible. We need soldiers that are going to go out there. Possibly, that's what I've been saying myself, house to house, street to street, and I know they have to be protected. But in this case, there's a war here. We've got to have soldiers that are prepared to go out there. But soldiers going out, they need to have the necessary gear for that.
Indeed, they do, Minister. And speaking of information and educating people, again, as you rightly point out, extrapolation has shown that the elderly are the most vulnerable when it comes to contracting the coronavirus. So there are people who have expressed concern that they, for example, do not have access to water, never mind drinking water. You know, we are expecting people to wash their hands regularly. So what sort of information are you putting out practically at this stage for people to actually assist them at this time?
Appreciative of that, President Cyril Ramaphosa already brought on board Minister Lindiwe Sisulu, who is the Minister of Water and Sanitation, on the basis that many people were exactly raising that. You know, I personally think that every crisis has got an opportunity, and this is the time that we need to sharpen our systems. This will help us also to really jack up in terms of our systems. The minister is now going to be part of the National Command Center, and we think that the department has the capacity and capability of going out there. But what is important is to activate the provincial and local structures. I repeat that because that is very important, because it's through them who who are really closer to the people. And the fact that we have the district development model, which the president already started quite a while back, we were requested that all of us as department must trigger those processes and make sure that we speak to our MECs, we make sure that they have the plans. And I already wrote out the necessary information to the MECs. I sent all the necessary information. And I know that they also belong to the provincial structures, and therefore they sit in the provincial structures. I'm of the view that we might not necessarily be perfect, but I think what we've done so far has shown that as South Africans we are resilient enough to pull our resources together. This is a very scary thing, because if you look at the figures as you were indicating in Italy and those countries that have already been declared, we must look at that, but we must also learn from what others are doing, those that are having better systems in place. And I know that the command center is in touch, and Minister Zweli Mkhize in particular, he doesn't sleep. He's been reading about it, he's been briefing us, and because he's a doctor, I think we've got a bit of an advantage, because we've got somebody that breaks it down right to the minute detail of what we are facing. And the scenarios that we've been given also by the collective are scary, but we are saying that we're looking at the worst case scenario. If it's a worst case scenario, how do we mobilize our people? My view is that if we work and we don't work with the people, we're not going to be able to make it. We've got to make sure that hygiene, cleanliness, and I think that it's an opportunity for us to raise awareness about cleanliness around our own areas, because while government has got a responsibility, citizens also have got a responsibility to take care of themselves, and they must sanitize, they must wash their hands, and I think South Africans are stepping up to ensuring that they do that.
Minister, again, the importance of disseminating information and making sure that it's not just about plans being hatched at the top, but that actually triggers down to the grassroots level, because it's one thing that the minister and the task team, the interministerial task team, come up with measures. It's quite another thing to have those implemented. What sort of monitoring and evaluation systems do you have in place to make sure that that information actually does trigger down to the bottom, and that people actually at that level do know what to do?
One of the things that I think is very important is the fact that President Cyril Ramaphosa has also made calls to political parties not to make this a political issue, but to mobilize and organize. Political parties have got structures, and today we have Parliament, by the way, and we're passing the budget. We're hoping that once people are down on the ground, we'll be able to use those structures for disseminating information, but they've got to have the information first and foremost. And so GCIS has been really working round the clock, ensuring that there are pamphlets, there are posters, and the president actually made a call on us to say we need to flood billboards, but we need to have the soldiers on the ground being informed what must be disseminated, because one of the challenges we had was fake news that is running around. In fact, I think that we were even on the point of saying fake news must be criminalized, because it's really diverting people from focusing on what this disease is all about. We'll use every power that we have, every platform that we have. And my department, together with SASA, we've got one of the best platforms. We've got trucks that are branded SASA. So we've made the directive that we need to activate those so that those can go out to the communities. You're right when you say that we can sit here in Pretoria or in Cape Town and be having plans, but those plans need to be implemented. That's why government has requested us, and the president in particular has requested us to have a properly coordinated effort, national, provincial and local structures. And all the resources have been pulled through. Tomorrow the president will also be having a meeting with the religious leaders, and I think he's going to be having meetings with the private sector. And we have also had the private sector calling upon us as the Department of Social Development. People are saying, we want to partner with you, tell us what to do, tell us where to go. Others have been saying, we've got soap that we want to distribute, tell us how we can be able to do that. That's why I'm saying this time around, this is an opportunity for South Africans to rally around each other and support each other. But the focus has to be among those who don't have, among those who don't get the information as quickly as possible, and in particular the most vulnerable, because one little mistake either in a township or in the rural areas, it will be very difficult for us to control. So the call to our people is step up, get up, and appreciate that it's right next to you, and you've got to make sure that you protect yourself.
Minister, early childhood development and children in daycare centres, early childhood development centres and creches. What is the situation there? Because we heard the announcement from the Department of Basic Education, but people don't know what to do as far as these creches and daycare centres are concerned. So what is the department's position on this?
The shutdown of the ECD centers, that's a directive, as a national directive to everybody, actually. And I did get some letters and some calls from citizens who were saying, look, we're running ECDs. We think that the children are better off at the school than at home, because these centers are also places where the children are kept safely, but also they are centers where people, especially children from poor communities, get the nutrition, because that's where they get the food. So we are thinking now, what else are we going to be able to do to reach out to the families of those children, because we appreciate and understand many of their parents are grant recipients, and therefore they even budget to say 2 meals a day, the children have it in the school. What's going to happen when they are at home? This is our call. Everyone must follow the directive, as the president has said. We must shut down. Because if anything happens in any of the ECD centers, it becomes a huge problem for government, but it also becomes a huge problem for the managers of the ECD. So we agreed, as it was declared by the president and the Minister of Basic Education, to say that we need to shut down. And again, we requested the MECs to say, let's think very fast about what we're going to do about these children. Fortunately, the department has got your relief plans, where we have to go out to those families that are poor and deliver whatever we can be able to deliver. We've got to look at our budget, because we've got a budget which is normally given to SASSA to be able to distribute food parcels and all that. It's a lot of work that we need to do, but I think we're ready to do it working together in a coordinated manner.
Well, Minister, that's all we have time for. Thanks so much for your time this morning. Thanks to Social Development Minister Lindiwe Zulu, who is also a member of the COVID-19 Ministerial Task Team, talking to us about the measures to be implemented by the Department of Social Development to limit the spread of the virus amongst the population that her department deals with. And that brings us up to News Time with Leanne.